What if I told you that the FDA just admitted they overstated the risk of hormone therapy? And because of that, millions of women have been suffering. Well, let's talk about what this means for your energy, your brain, and your overall long term health. Hi, everyone. If you don't know me, my name is Dr. Steve Jones, and I'm at Revive Longevity Center in Texas. And if you are an entrepreneur or business professional over 40 who wants to start showing up at work sharp and decisive like you used to, then you're in the right place. Today, we're going to do a deep dive on hormone replacement therapy and why the recent decision by the Food and Drug Administration to remove the black box warnings is a game changer for midlife wellness. We're also going to hone in on topical bioidentical hormone replacement therapy, BHRT, and how that strategy fits into our approach here at Revive. And finally, I want to introduce you to what we use. It's the Bright system along with the menopause method. These were developed by Dr. David Rosensweet. It is an amazing signature solution for women in that 40 plus vitality zone. But let's start by setting the scene. You see, for decades, HRT was used to support women through menopause and perimenopause. It addressed all the things, the hot flashes, the night sweats, the sleep disruption, mood changes, bone loss, sometimes even cardiovascular risk and cognitive concerns. But then around 2002, this landmark WHI, Women's Health Initiative study, suggested that there may be increased risk of breast cancer, heart disease, stroke, and dementia. That's very serious, and that triggered the FDA to require black box warnings on many hormone therapies. But those warnings had a really chilling effect. Many physicians and clinicians, including myself, withdrew from the use of HRT, even though we did have some lower risk, well-selected options. And that caused the lives of many women to be impacted. Quality of life worsened, symptoms persisted, and many women just felt like there were no good options. Now, the big news, the FDA has announced that they will begin removing those black box warnings. And this is going to happen on most HRT products that are used for menopause symptoms. The key points here are that these box warnings included risk of heart disease, breast cancer, and probable dementia. But the agency said that its expert review found that for many women, this risk was overstated and misapplied, especially when HRT is started earlier, like under the age of 60. And also, it makes a difference on what formulation and delivery method you're using. The FDA is not removing absolutely all warning language. For example, when we give systemic estrogen alone and a woman has a uterus still, we need a warning about endometrial cancer. Now, the move does signal a shift in how the medical community is going to talk about HRT. Less fear, more nuance, and more personalized decision making. Now, what this means for you is that if you have been putting off considering hormone therapy because of this fear, misinformation, and outdated warnings, this change invites a fresh conversation. So why does this matter now, and exactly what is my angle as the medical director at Revive Longevity Center? Well, why it matters to me, see, midlife professionals often undergo these hormonal transitions, menopause and perimenopause, that truly impact their vitality, cognition, sleep, mood, bone health, and their long-term wellness. And the removal of these fear-based labels opens the door to more open, evidence-based discussions. So we can now focus on who is the ideal candidate, when they should start, what formulation and route, how dosing and monitoring are going to matter. Safety and topical BHRT is an important topic. At Revive, we favor topical transdermal BHRT options. And we really like the bioidentical hormones because topical delivery bypasses first-pass liver metabolism. And that tends to have a lower risk of the blood clotting events and other systemic adverse effects that happen when we take pills. Bioidentical means that the hormones are chemically identical to human hormones. They're not like the synthetic derivatives that we see, that we take orally. To me, this is cleaner, it's safer, and it's more physiologic. Now, the risk picture is very different in a younger, recently diagnosed menopausal or perimenopausal woman versus a woman who has been past menopause for a decade or two. And HRT is, when it's initiated within 10 years of menopause, we're going to see more benefit and fewer risk. And these black box warnings, they were applied broadly. Even vaginal applications were shown, which were not shown to be a problem, had these black box warnings, and all of that is being removed. So at Revive, we want to be safe. We're going to do a comprehensive baseline assessment. I need to know your cardiovascular risk, your cancer and breast cancer history, and what your hormone levels are. And then we need to individualize patient selection. Not everyone is a candidate. We have to screen for contraindications, something that we do on every consultation that we take on. Now, choosing the right form, the right route, the right dose, and the right monitoring plan are important. Topical BHRT allows for lots of titration and flexibility. And then ongoing monitoring about what's going on in your health, but also your symptoms helps to guide treatment. Education is always important. We want to empower our clients to make informed decisions that are best for them. So listen, this is not a blanket yes for HRT for everybody, but what it is for the right candidate in the right way is an opportunity to have a new discussion, because BHRT is a very safe and viable component for the vitality-focused entrepreneur who wants to focus on longevity. So this patient that I was talking to last week is a professional. She's in her mid-40s. She has a couple of teenage daughters. I think they're in junior high. She came to me a couple of months ago doing all the right things, working out, eating well, getting her sleep, but things just weren't right. She felt off. Hormone transition is tough. She was struggling at work. Her confidence was really lacking. A month or maybe 6 weeks after, she has shifted into feeling confident at work. She's not having to read an email 10 times to make sure she didn't make a mistake. So by working on her HRT and supporting her lifestyle, getting her circadian rhythm back on track, we made a big difference in how she feels. Now, I'd like to talk to you a little bit about the particular system that I use. It's called Bright. And it's brought to us by David Rosensweet, a physician out in Florida, and his menopause method that he put together over 2 decades ago. So the menopause method is a highly structured and evidence-based protocol that's perfect for women in midlife. It combines hormonal support with lifestyle, metabolic resetting, brain health, and really strong longevity techniques. So in our clinic, how it works is that we start with a deep dive assessment. We want to talk about your hormonal symptoms. We want to look at some metabolic markers, body composition, and then talk about sleep and circadian rhythm as well. The Bright system then gets integrated for most women. These are tailored bioidentical hormones that are applied topically. And then we can support our metabolic pathways with peptides, NAD, advanced nutrition, specific supplements, and then some kind of focus on lifestyle and stress resiliency. So over a period of time, we will monitor your symptoms. We look at not only hot flashes, but really like brain fog and confidence, and how your body is responding as a whole to the treatment. And the result, well, women tell me all the time that they feel like themselves again. They feel sharper, they feel stronger, they have a renewed vitality, improved libido, and they feel like they're performing better than they had in decades. So if you're wondering what a postmenopausal blueprint for a high-performing woman should look like, this is it. And in this new regulatory landscape, we can really reinforce the fact that hormones are not the enemy. In fact, they are a key component of midlife optimization when we use them thoughtfully. Look, if you found this video helpful, I would love it if you would subscribe. I really want to bring more content about longevity, some vitality-focused insights, and I would love it if you would share this with a friend or a colleague who is also navigating some of the complications of midlife. And if you are in the 40-plus neighborhood and ready to get through a full week without feeling spent already, then please book a consultation with me. We'll walk through your goals, we'll look at some markers, and we'll decide whether this path is a right fit for you. Thank you so much for watching. Here's to you reclaiming your edge, your power, and focusing on your health span.